In every era, there is a need, a spark, an instinct that brings us together to imagine and to innovate. This hasn't changed. What's possible has. We create technology that makes our world better. Ideas that move us, empower and connect us. But great ideas cannot thrive alone. They need to be shared, challenged, refined. Through our insight and collective curiosity, we advance and grow. New solutions, new directions, new answers. We do that here, together. This is the age of connected intelligence. Welcome to the IQ era.
Good afternoon, everyone, and welcome to Hacking the Human Mind, the brave new world of brain-computer interfaces. I'm Anna Yorga. I work at the intersection of consumer neuroscience and behavioral science and technology, helping companies understand their customers, and I'm delighted to moderate today's discussion on brain-computer interfaces. I would like to introduce the two panelists together, Carolina Aguilar and Jonathan Swan. Would you please join me on the stage? So, for decades, the brain has been the last box in technology. We've mapped the genome, we've digitized the planet, we've connected billions of people, but the human mind has remained in many ways private and biologically independent, and that is beginning to change. Brain-computer interfaces are moving from research labs into clinical trials, from assistive technologies into commercial conversations. And we are no longer asking if we can interface with the brain, but how and at what cost, and whose responsibility is it. BCIs promise extraordinary breakthroughs, restoring movement, treating neurological disease, augmenting communication, but they also raise unprecedented questions about mental privacy, agency, safety, data ownership, and the long-term implications of integrating technology with our most intimate organ, the brain. Today we are fortunate to have two leaders shaping this space from very different technological approaches, invasive and non-invasive, medical and adaptive, each navigating not just innovation, but ethics, regulation, and commercialization. And this conversation is not about hype. It is about trade-offs and about design choices being made right now. And ultimately, it is about, as we build technologies that can read from and potentially write into our brains, what kind of human future are we architecting? So first of all, I'd like to introduce the panelists, and then we'll jump into the conversation. So Carolina, she's the CEO and founder of InBrain Neuroelectronics. And with over 20 years of experience in healthcare, Carolina has a proven track record in scaling innovation. Under her leadership, InBrain has raised over 100 million, achieved FDA breakthrough device designation, and delivered the world's first graphene neural implant to humans. Congratulations.
Thank you.
And we also have Jonathan Swan. He's a co-founder and CEO of Xander Lab. Jonathan spent over 20 years scaling tech companies and driving corporate success in companies from startup to major enterprise, including successfully building and exiting multiple organizations and navigating 100 million deals across corporates. Now he's tackling humanity's next interface challenge, working at the forefront of non-invasive neuroadaptive systems that interpret cognitive states in real time. That's impressive.
Thank you.
So before we talk about hype and what's not hype in this space, if we strip away the headlines, what can BCIs reliably do today?
You want to start?
Go ahead, Carolina.
All right. On our case, indeed, we have an implantable brain-computer interface that sits on the skull, and it has few sensors, in our case using graphene, which is an advanced material that can read and write on the brain in high resolution. However, in our case, as I was saying, it's always on a therapeutic way. I mean, we are able to actually detect disease brain biomarkers and also some of the nervous system's biomarkers that are more peripheral, and we can respond in real time in a very personalized way and in a very precise way to treat disease areas like Parkinson's disease, epilepsy, but also other more systemic cardiometabolic conditions.
What about you?
Yeah, thanks. So our technology is non-invasive, as you said. We built and developed a sticker that sits on your skull and that translates EEG data to a very small miniaturized amplifier that decodes that into high-precision mental states. And we can do that and detect mental states such as workload, focus, attention, intent, surprise responses, and error responses. And we use all these different mental states and feed these into physical AI models so they learn from us humans and they understand a bit more how we see the world, how do we interpret the world, and in that way become more human aligned and more human compatible.
And where do you see the biggest gap now between scientific capabilities and real world deployment? Because scientists, they just like to talk in their own sphere, you know, but what about what's practically possible?
Well, impossible is a big word. I think that many things that we thought back in the days that were impossible became possible. So it will be a factor on the evolution of time. But I have to say that we have not progressed as much as we thought we could, I think, in general. We have decoded the brain of a zebra fish. You know, we are trying to decode mice. But we have not decoded the most part of the human brain, which is 100 billion neurons. And I think that's a challenge. I think new technologies, advanced materials, give us now a chance to look at the brain in higher resolution. AI makes biocomputation much faster. So we have I really believe that the next decade, we are going to progress immensely on this field. However, it's always going to be complex to understand the nervous system. I'm not just talking about the brain. So the brain is the central nervous system. Then we have also the peripheral nervous system. And the whole nervous system is a big enigma. But I think we have a great decade ahead. And it's always up to values. How do we decide to use that decade?
Yeah, I fully agree that we haven't come as far as we would have liked. In our case, I think for the non-invasive BCI tech, we have had this going for decades, and we've made really good progress in the lab in really very controlled conditions with big full headsets of 96 or more electrodes, very quietly seated behind an experimental table. But it's been very hard to build scalable products that work in the real world. And these are the steps we're currently making, and they're driven by transformer architectures, by new chips, by gathering lots and lots of data, more compute. And this is where we are at the moment. We're trying to bring what has been done in the lab into portable mobile technologies that still give us really good high quality answers, maybe not to the perfection we do in the lab, but good enough to build scalable products.
Okay, so then what are the limitations that you see when you try to translate from the lab to the real world where you have so many variables at the same time?
Maybe, if I'll just continue on that, because for us it's generalization. In the lab, imagine if you want to really obtain an accurate workflow measure of someone or workload measure, cognitive load, how busy is the brain versus how relaxed is the brain, right? We typically calibrate. We build classifiers, algorithms that detect that, and we typically calibrate that with certain paradigms, training paradigms for 15 minutes, 20 minutes, in order to have the following hours really good, pretty accurate workload measures. And the challenge is that our brains differ immensely from person to person, from day to day. And how do we create algorithms that are universally applicable to you, to me, every day? And then not just in the lab, but also outside of the lab, in different contexts, in different environments, where there's noise, where there's distractions. So that's a really, those are our major challenges, is generalization of these algorithms. And for that, you need to gather, in our case, lots and lots of data, thousands of brain data sets, where you evoke mental state responses, and then you use AI to decipher and find a universal signal.
Yeah, exactly. And when you said that our brains are different, I was thinking, if I have a fight with my teenager kids, my brain is going to be completely different than half an hour ago when I was, serene, and then all of a sudden. So yeah.
Very recognizable, yes, thank you.
So what about you? What are the limitations that you see in the clinical space?
Yeah, well, it's been, I think, a technology problem. Of course, every brain is different, and personalization is one of the key areas of success. I think precision is the other, or the capacity to actually decode and listen to the brain and understand where are those disease areas, but then be very precise on where you actually write or stimulate or modulate to actually get to the right pathway in the brain that produces the right outcome without creating any side effect. And I think we've been decoding from the brain with metal technology, meaning sensors with very low resolution, very big contacts that were creating a lot of noise, a lot of averaging of what that brain was saying. And when you respond to noise, the effectiveness is not that big because you don't know. But if you are now able to read precisely where that disease path is and write on that specific area without creating any side effect for that particular person, and also in relation to what that person is doing or feeling, then is where you have the highest effectiveness. And I think it's been that problem where tools were not actually giving us the information that we needed to respond in the best potential way.
So, so this actually, all these improvements that you're doing in the clinical space will actually help doctors and all the other tools that they use to finally find some or achieve some breakthroughs in their treatments.
Yeah. So it's like finally having a TV in high resolution or a microscope in high resolution that tells you what you have to do, how you have to act, and it's all clinically relevant with clinical tools. So it's not an experiment or a research activity anymore. It's embedded into real clinical workflows, into real surgical workflows, and it will continue advancing at a high speed because, when we are going implantable, also the peripheral tooling is important. For instance, now micro-robotics start emerging as well. So the invasiveness of one of these implantations is also going to evolve dramatically in the next years, where micro-robotics are going to be part of those clinical workflows. So I think we already had pacemakers, who doesn't know a person with a pacemaker? Cochlear implants in 7-month-old babies that were able to listen. Well, this is going to be exactly the same. It's going to be a companion that is going to diagnose and treat real time in a least invasive way possible.
Yeah. So that's a lot of hope, actually.
Yeah, well, I see it every day happening. So.
So if we think of the hype and what's in the media, when people talk about brain-computer interfaces, what do you think is the most persistent misconception that you encounter and that annoys you?
In my case, I would say this human augmentation to the superpower effect, or uploading 700 languages in your mind, and being extra intelligent. I mean, I think those things are really on the science fiction page of history.
When I was in medical school a long time ago, I was hoping there would be a way I could get all that information in my head, and so I didn't have to study for like 10 hours a day. So yeah, but that's still not possible.
Nope.
Yeah, for me, the biggest misconception is, can we read your thoughts? And so there's a lot of anxiety. We do a lot of tests. We bring people in. They sit there for 3 hours. We do lots of tests with them. And then we really have to explain what it is that we do. And we look for responses and mental state responses in various forms. We do not read your thoughts. We cannot read your thoughts, not today and not tomorrow.
Exactly. So I remember we were doing consumer neuroscience research with EEG a long time ago, and we had this one lady where she came in, and we asked them to read, like to sign that they agreed, and she said, no, someone told me that EEGs are demagnetizing my brain, so she didn't want to participate. And that was a new thing. I was like, how do you demagnetize the brain? But yeah, so people have all these crazy ideas about BCIs. If we look at another thorny issue is related to ethics. So who owns the data? I mean, the thoughts, not the thoughts, because it's not really thoughts. Who owns the data that you get from the brainwaves?
Yeah, I love the question because I think we've been there with DNA or genetics, right? I was one of the first early adopters to sign into 23andMe. And although that company actually, sadly, has gone bankrupt, I really love how the process of owning the data was proposed to the users. And I think to me, the data is from the owner, right? So if we can actually own that data, consent or not, or have the decision-making power of consenting or not for whatever very clear purpose, this is where I think BCI has a place, because at the end, I want to be cured and I need someone to help me. Same as the doctor. You are going to provide your own medical data to your doctor so the doctor can act on your condition. The same is happening with technology like this, right? But we have to make it simple and clear for everybody to consent or not to whatever they are signing for. Because if I look at social media and I go to my privacy policy, I have 4 pages with hyperlinks. I never know anymore what I'm consenting or not to. So I think regulation, at least on implantable technology, is very clear about that. Class 3 medical devices have a very clear regulation, but others not so much. And I think this is where the ethical problem comes, and we have to be responsible.
Yeah, I think it's a really good question and a topic that we could discuss for about the rest of the afternoon. And it's really hard. But I mean, just looking at data ownership, I think I agree with you. I think the user owns the data, but more importantly, needs to control the data and needs to be able to withdraw. And also, if you're mentioning consent, it cannot be a click-through agreement that you do. It needs to be clear, needs to be transparent. If you're giving away certain data, it needs to be very clear what it's being used for, how long it sits, whether it strips from personal data, and control to withdraw from it. So there are a lot of areas that come into play, but purely ownership should sit with the person. And maybe one extra thing, in our case, we still believe there's raw data and there's the interpreted data. The raw data, in our case, we really try to process it on the fly and make sure that it doesn't hang around, but that we only use the decoded mental states.
So that was my next question. Is inferred data, like emotional, cognitive states, what you're extracting, is it actually more ethically sensitive than raw data?
Yeah. So I think that's also a very difficult question, to be honest. And it's tempting to say that inferred data is more sensitive because it really gives away. I mean, look at our socials, what kind of profiling we can do with a thumbs up and a thumbs down. This is a very different level, of course. So you need to be extremely cautious. So the control needs to be there. There needs to be absolute transparency and clarity on what it's being used for, what you're passing out to, in our case, maybe a robotic system or autonomous vehicle or a surgical robot. That's really super critical in that sense.
And you're talking about risks before, and about moving from lab to the real world. So what are some of the risks that you noticed, not only technically, but like socially, cognitively, emotionally for people? What have you identified?
Yeah, there's another afternoon, but while I remember, just finishing on the inferred data, the raw data is something we should also be extremely careful with, because maybe now we can only defer certain emotional states, but in the future there's a lot of decoding capability coming our way very rapidly. So hence our way that we don't want to make raw EEG data available, upload it to the cloud, and so on and forth. Sorry, you asked about the challenges.
The risks. What do you see? Not only technical risks, but what do you see? Like, it could be reputational risk. It could be people interpreting or positioning, or I don't know what kind of risks. I mean, medically there are for sure different risks. People could sue the company because they think it demagnetized their brain. And in your case,
for us, it's kind of the profiling. So you need to be extremely careful whether, due to normalization of the kind of technology, it goes into society and employers can really see how you as an employee are behaving and acting. But it goes at different levels, of course. But that's certainly one aspect, but also socially, the people that get access to this kind of technology. And that's not just for our BCI tech and the kind of physical AI systems we train, but I think for AI systems in general, or technology in general, is there, of course, a social divide. These systems are enhancing our capabilities, are making us more productive, are going to be incredibly smart, and be really good for humanity, because we believe we make computers work better with us, rather than us having to adjust ourselves to fit the computer. But at the same time, the people with access to the kind of technology are going to have immense benefits of it, and the people who do not have access to it. So the divide of people with tech and capabilities and the people who don't is going to be increasing, and that's a social risk.
So it's going to be the new inequity, whether you have access or you don't.
It just increases and advances it faster.
Yeah. What about in the clinical space? Have you identified any risks?
I think in the clinical implantable space is easier, let's say, because at the end it's a treatment that is prescribed by the doctor, which is fully reimbursed, so there's not out of the pocket or inequality on who can afford it or not. It's going to be fully reimbursed by the nation's healthcare systems. So it's much more in line with equality, because at the end, if you need it, you are going to have it, if you want it, of course. However, it's also about patient selection, right? Training physicians to use this kind of technologies is very important, because just like any drug or any pill in the wrong patient at the wrong doses, it can also create a harmful effect. So someone with a depressive state, someone with a mental issue, it's not going to be as fit as a person that fulfill all the clinical criteria. So it's just like another treatment path.
Correct. So for the audience, for the leaders and builders in this room, what is one mindset shift they can make today to help steer BCIs in a positive direction? And to make it more
without
relevant?
a doubt, is the benefit that it's bringing. I don't know if you have ever seen just a Parkinsonian patient. I remember this vividly. The first time I was 30 years old and I was in a Congress of Parkinson's disease, and it was this woman in the front of a piano, in the Congress hall, and the doctor just came, switched her on, and started playing a magnificent concert.
Wow.
And I remember I started crying, and I said, wow. And she told me, I have 2 birthdays. The day I was born and the day that I received this therapy. And from that day, I devoted my life to this. Because once you see it with your own eyes, you cannot get your mind out of that and the good that it could really do.
That's powerful, yeah. Yeah.
Yeah, I think we should have finished with that. I think that's a very beautiful story. But no, I think what is there, this technology is happening today. This is not something exotic, sci-fi of the future. Sure, if you extrapolate and think it further about capabilities, you can go all out. But it really is happening today. It's moving out of the lab in the real world. It's improving physical AI systems, robotics, autonomous, semi-autonomous vehicles and such. And get on this train. It's super exciting. It is going to turn computers and AI systems into systems that are better with us and more aligned with us. And we should really encourage that and embrace that.
So what, go ahead.
No, if I might add as well, I mean, not even pacemakers are making a 1% of the population penetration. And I'm talking about life-saving technology that if you don't have, you just died. So in Africa, for instance, there's a very low penetration of pacemakers, let alone, a high penetration of neurologists or, clinicians that actually can treat these disease areas. If now we bring AI in a safe way, and of course regulated with, all the safety networks around, we actually open a space to virtual physicians or autonomous therapies where if you have an implant, you are going to have also the neurologist within you reading and writing, or let's say diagnosing and treating real time with a lot less human effort, but still the high effectiveness of therapies like that. So I think if we do it right, this is an amazing step for humanity.
Yeah, I haven't thought of it like that, actually, yeah. So what keeps you awake at night, and what is so... what's the driving force behind what you do, and what keeps you, awake and excited about the future?
No, please, you go first.
Well, this is a very competitive market or world. I mean, we have our dear Elon Musk with Neuralink. He put $1 billion into Neuralink. Many close followers with deep pockets. I think it's one nation that is kind of, leading the path. We have then China also putting a very structured program on BCI to get it to the sovereign level of, strategic technology. And then we have Europe kind of in the middle. And I don't know if you have read a book called The Digital Empires. This is exactly how the book, plays. So from the European perspective, I think we need to decide, how are we going to support or not deep tech and BCI technology. So we are competing in fair terms, for the good of humanity. And I think this is where I stand in these crossroads, where we really believe that this is the way to go. But we know that alone, it's very difficult to make it. So even if we made major steps in a very successful way, I think we need the support of the region and the support of the mindsets that believe this is the right path.
Correct.
Yeah, lots of things keep me awake at night, I'm afraid. Europe and our support for the deep tech ecosystem is also one of them. And the immense capital and ecosystem that goes on in the US and in China is certainly part of that. For us, it's also really how to scale very fast amongst ourselves here with our teams and find development partners to work with that believe not in just the sci-fi, but also see the current state and where we are and want to get the benefits out of that. So this is something that we are working on very hard.
Awesome. So I would like to open the discussion to the audience. If there are any questions, there is someone with a microphone. Yeah, so there you go. And if you'd like to specify who the question is for both.
Thank you so much for the presentation and meaningful dialogues. As for the competitors that Carolina said, not only Starlinks and then other companies that is working on brain computing, but there is a implanted tips and then under the skin, or still there is a AR glasses and then other devices that can be used for AI. So how do you think? What do you think about that kind of competitors, and then what's the differentiators that do you think of brain computing?
Yeah. I mean, there's a lot of wearables, implantables, but I think there's not so much. How can I say? It's very difficult to actually go into the brain and decode it and modulate it in a way that is actually meaningful. It requires a lot of years of knowledge, but it also requires very advanced technologies, and the barriers to actually get to those technologies, implement them at a scale, get the funding. I mean, it at the end is a compound of levers that you have to put together to actually first build the technology and then scale it. So I think the barriers to get there are very big, and only few that are really outcome driven will actually make it to the level that is meaningful.
So you mean if you can achieve the brain computing, the AR glasses and then kind of other, devices can be kind of disappeared?
No, well, what I mean is that it also depends if it's therapeutic or just, a lifestyle kind of device, right? So lifestyle, I think we will be a lot of them. We have the Apple Watches, we have, like so many gadgets already. I think therapeutically is where the difference will be, and will be only a few that actually make it. The rest, yes, we'll have a plethora of lifestyle companions that we will use for many purposes in different fields. I don't see that disappearing. No, it's cohabitating.
Thank you.
There is one lady in the front here. And
Hi, thanks for a great panel. One question. So could this type of technology help aging population to stay competitive in the upcoming world? Because the problem is we have more elderly people, less babies are born. So elderly people, they need to be productive and active during extended lifetime period. And actually after your 30s, 40s, your brain function start decline. So could those type technologies help us?
I think we're going to have very different answers to that. The technology that we develop, not directly, but the supporting mechanisms and the AI systems that learn from us humans will help elderly people to still be active and productive, because they'll be much more tuned to them, they've learned from them, and they can support them much better. So that's an indirect way, I guess, of driving longer, working behind the computer longer, and so on and forth. So yeah, I believe it's really going to help humanity in that sense too. But I think you will probably answer that quite differently.
On the therapeutic side, there's a lot of evidence about memory restoration and Alzheimer's kind of reversion. So in the way of extending life, for sure. And I think these devices are going to have couple external memory that it's going to feed back to those patients in a very special way and empowering way. So I think, I always said that intelligence equals memory, because we are not as smart just because we forget everything that we've learned. So if we have other ways to actually compile that memory and give it back to these people to actually better take care of themselves and enable their ecosystem, that's going to be an indirect way to actually support this population for sure.
so there was one question there, and that will be the last one because we are over time already.
Thank you. Really interesting discussion. I was just wondering how, between the two of you, you've dealt with the security challenges that come from these devices.
Yeah. In our case, again, under Class 3 medical devices, both under FDA in US or MDR in Europe, this is super regulated, and there's all the ISOs that you have to comply with, all the testing that you have to do, verification and validation. So there is a very clear path to follow and check. And then there's an audit program where they actually verify if you have done it and if you have checked it and if you are fit to commercialization and therapeutics. This keeps evolving. We are, for instance, part of the TAP program of the FDA because we got the FDA breakthrough designation, and it's a constant conversation with the FDA every month. So I don't have any concerns around that area.
Yeah, maybe just from our point of view, the key thing is so we record the data, we pass it on either wired or through a secure Bluetooth connection to a processing device. And out of the processing device, it's manually operated, and you select which mental states you want to pass on to an AI system. So that's your consent and your control. And the EEG data, the raw EEG data, is removed, is not used. So that's kind of our security by design or privacy by design setup, if you will.
Thank you very much, everybody. We are out of time, as we're notified. Thank you, and enjoy the rest of the exhibition.
Thank you, Anna.
Thank you, Anna.
Thank you. Thank you.